Hey, DNA. Thanks for joining us on All Access DNA. I'm your host, Kate Wilson. Today, we are talking about patient provider communication and how people make decisions with uncertain information. Dr. Marleah Dean Kruzel joins us to share her research on communication, as well as her personal story, as she is a previver with a BRCA2 mutation. She also shares additional resources and her TEDx talk. Let's get started. Hi, Marleah. Thank you so much for joining us on the show today.
Thanks so much for this opportunity. I'm excited to chat with you.
One of the things that I wanted to focus on was your research on communication and thinking about the communication between clinicians and patients, which is a huge part of healthcare, medical care, but I think it's one that maybe both on the provider and patient side, we don't think a lot about is how we're communicating with each other. So, why did you decide to focus your research on this?
Yeah, that's a great question. I think communication is really the mechanism through which care is accomplished, right? So, effective communication, it influences our understanding, decision making, and ultimately our health outcomes. But for me, the interest in communication was very personal. My mother was diagnosed with breast cancer when I was 8 years old. And in the years that followed, I watched her undergo surgery on her left breast and then chemotherapy, radiation. And then she had a prophylactic mastectomy on her right breast and then finally reconstruction. So I lived in hospitals for quite a while. And I decided to become a researcher from a very young age, basically because I wanted to give back to the medical community who saved my mom's life. And I knew after those experiences in the hospital that I couldn't be a medical doctor. It was just too difficult from the medical side. But I also really wanted to make a difference in terms of helping patients and their families and clinicians be able to communicate effectively about cancer and medicine overall.
And do you recall at the time with your mom, did you feel like that your parents understood what was going on, or you even as a kid? Because as I was listening to you, so you have a TEDx talk, which we'll link in the show notes. I was actually thinking back to, so my father was diagnosed with malignant melanoma when I was 8 years old.
Mm.
And I was going back and thinking about, did I really understand what was going on? And did I ever even actually talk to a healthcare provider? I was like, I don't even think so. At the time, I probably was more sheltered, not even going to the hospital. So I'm curious to know, like, was that something that you had in your experience, which was working with the healthcare providers?
Yeah, absolutely. So I was a very involved 8-year-old. I'm a firstborn, and I wanted to know what was going on with mommy, and I knew something was going on with mommy, and my parents were really great in terms of giving age appropriate information and involving me in ways that they felt was appropriate for my age over like 8 to 12 years old, really those 5 years when we were in and out of hospitals and things like that. So they did protect me a lot in terms of, the extent of it, but when you are in a house where your mother is undergoing chemotherapy and side effects of that, after surgeries, being very careful to not touch mommy in certain places. She was fatigued, right? And so, yes, I saw the side effects of that in the home. My parents included me in a couple key visits when they felt like it was appropriate. And so I think it's really important to involve children and think about, care and communication from a familial perspective.
And one of the reasons too is just thinking about, there's the patient provider communication, but then the patient and the rest of the family communication. And then I'm sure there's multiple different types of communication between other groups. So why is communication so important in terms of healthcare? It's not just information giving. There is this kind of back and forth reciprocal engagement that's happening.
Yeah, absolutely. I think what's really important in patient clinician communication or patient family communication or that triadic communication where you have both the patient, family members, and clinicians is that everyone has their own attitudes, values, beliefs, and behaviors, and they bring in those things into any conversation. And that is going to influence the communication that occurs between everybody. And so communication is really where decision making happens. The care, people feel empathy from a physician or there's shared decision making going on. Communication, we know from research, it leads to better health outcomes. That can be emotional health, physical health, functional health, mental health, right? And effective communication can, from a clinical side, we know that it enhances patient compliance or adherence. And so I think that's really important to keep in mind. From a healthcare organization perspective, the Joint Commission on Accreditation of Healthcare Organizations had a statistic several years ago that 80% of medical errors are due to communication breakdowns. And so if as patients, we don't fully understand our options, if we don't trust our clinicians or we feel uncertain about next steps, that really tends to go back to the communication that's occurring between and among those different types of people.
So it sounds like there is this way that communication saves lives or I mean, really truly does impact someone's health.
I mean, in my own research, a lot of my research looks at previvors, so people who are genetically predisposed to hereditary cancer, but who have not been diagnosed with cancer. And so, understanding one's genetic predisposition enables previvors to make informed health decisions, right? So, you're looking for cancer in your body. You are maybe preventing cancer through prophylactic surgeries, risk-reducing surgeries, or you are undergoing personalized treatments to reduce risks and ultimately improve outcomes. And all of that really goes back to communication, right? Sitting down with a genetic counselor, for example, and learning about your potential risks before you undergo genetic testing. And then post genetic counseling, what it looks like for you in terms of moving forward and what types of decisions you might make in terms of screening or surveillance. And then if we think about cascade testing, right, within families, that's driven by communication. When information is shared effectively, and as a communication scientist, it's important that it's more than once. It's not just that disclosure of positive genetic test results, for example, that can actually lead to prevention and treatment across generations, really making an impact in terms of legacy. So communication, when it's effective between healthcare providers or clinicians and patients, quality of care is improved. Patients and providers are more satisfied, and you are achieving ultimately everybody's goals.
What are some of the biggest barriers you've seen when clinicians are trying to communicate with patients? Because, like you said, it needs to be effective. So, what keeps it from being effective?
Well, I think when you think about your own experiences interacting with a healthcare provider, you might first off think about time constraints, right? Usually appointments are pretty short, depending on, what type of appointment you have. But those time constraints, I think, impact and create challenges for clinicians and, of course, patients too. In the US, we have quite a fragmented healthcare system as well. And so that can make it really difficult in terms of tailoring communication to individual patient needs. But I actually think the biggest challenge for clinicians when they're trying to communicate with patients is there is misalignment or miscommunication between what's important to the clinician and what's important to the patient. And so if you think about when you go to the doctor, we typically go to the doctor because we're uncertain, we don't know, right? And physicians usually we feel like just want us to get to the point, and clinicians are usually asking questions about our physical bodies. Whereas, patients, we tell a story, we tell a narrative, we recount the symptoms that we've had and for how long and how that relates to our families, right? And so then on the other side, we have physicians, they tend to think patients share too much information, right? And focus too much on emotions or environmental concerns or sociocultural factors, right? And so there's really this conflict between the approach to care. And so I think that's actually the biggest challenge is we come from two different worlds. There's language that, physicians come from the voice of medicine where they're focused on the patient's body, and that's how they're trained for years in medical school. And patients, we seek a more holistic focus, right? The emotional, the social, the psychological dimensions of care. So the voice of the life world or a biopsychosocial approach. So I actually think that is the biggest problem when it comes to communication challenges.
Yeah, and I mean, it's different communication styles and kind of not just how they're telling the information, but how they're hearing the information and then using it to try to make sense. Because, like you said, the patient, it's their narrative, right? They're trying to figure out how to pull this into my daily life. And one of the things too that I think is so interesting about communication and science communication is thinking about, disseminating information, telling a story, but how do we do this with things that are so technical? So you
Mm.
think about like innovative research or things that are going on at some of those diagnostic labs. How do you see people trying to make those transitions from, we have this clinical trial and explaining it to a patient, right? Like why you should consider this. How do you think people can, I guess, use communication and storytelling to take things from research to the real world?
Yeah, I so appreciate that question. I think stories, or in my field of communication, what we often call it narratives, that they really bridge this gap between evidence based research, scientific discovery and innovation, and the lived experience of patients. And we know from research about narratives that narratives are a mode of reasoning. It's the way in which we make sense of what's going on in our world, right? It's through stories that we explain and we understand and we make decisions. And so I think when researchers or academics in general are trying to get their research out to the general public, storytelling is a great way to do that. It's beneficial because it grabs our attention, right? They're relatable, it demonstrates authenticity, so these are all really great benefits of storytelling. As just one example in my research, using narratives. So I've conducted probably hundreds of interviews with previvors about their lived experiences. And then I create and utilize actual real language from those patients in the interventions that I create. And the idea is to help people feel seen and heard, give them a space to relate to others when they're trying to make decisions, or even if they don't have a social support system. And so I think storytelling is really the way in which to connect with other people and to make their message memorable.
What are some maybe tips or things that you would tell folks that are listening that are researchers or scientists, like that are struggling with trying to maybe translate their research findings or trying to communicate some of this technical information?
Yeah, so I would say first and foremost is to actually try and include, visuals or narratives, right, as a way to connect with your intended audience. And there's lots of different ways to do that in the science communication world. We have infographics as a visual, patient stories as another example. There's op-eds using social media, things like that. But really, when you're using a story, making sure it connects with your intended audience. So, a story about a cancer previvor might look very different than a cancer survivor or someone who doesn't even agree with that label, right?
Mhm.
Think think storytelling and translating research is a muscle that we're not trained in academia. And so, really practicing how to explain your research to a non expert is really helpful. So, you can think about, explaining something to an eighth grade health and nutrition class or something like that. Or envision that you're talking to your family members at a family reunion this summer or at Thanksgiving, and then getting feedback on that as a way to connect and using plain language. I think this is something that's really difficult. Oftentimes, as a researcher, you want to explain all the details and the nuances about the method and the theory and why that's exciting and how we're making an impact in those spaces, theoretical advancements. But in terms of the general public, they don't really care about the method. They don't really care about the theory. They want to know, how does this relate to them? What's important to them? Key takeaways, very simple key takeaways that aren't using medical or scientific jargon is really helpful. I think if you are starting off in this area as well, it can be really helpful to partner with people in your intended audience. So if you want your message to connect with patients with diabetes or with heart disease or cancer, right? Involve them in the process and involve them in the process early. It shouldn't just be at that dissemination phase. Pilot testing materials. So if you're using different types of SciComm products, getting feedback early before the dissemination and then actually making those changes so that we're reducing any possibility for misinterpretation or confusion.
That's helpful. And I would say one of the things too that I think is so interesting about communication is that one of the things, the reason we're communicating, right, is to try to be clear, clarify things, make sure that the audience or the patient or the client or whoever we're speaking to can understand what's going on. And that they don't feel this mystery or uncertainty. And I know that's
Hmm.
an area that you've also looked a lot at and thinking about communication is like this uncertainty. I think you said in your TEDx talk, the only thing certain in life is uncertainty. But I think, that's one of the things with communication that we're trying to clear up. But it's a challenge because there is some uncertainty that's inherent and part of science and genetics. Like we don't know everything.
Hmm.
So, how do you think that people can discuss this uncertainty, and why people find it uncomfortable to hear about uncertainty when it comes to medicine and health?
Yeah, I think you're explaining that very well. And I think there really is a discomfort with uncertainty in science, medicine, genetics, even more specifically. To be clear and define our terms, uncertainty exists when there is a situation or information that is probabilistic, ambiguous, or complex. And so, probability, likelihood of a future event or outcome. Ambiguity really gets at conflicting evidence or the evidence's strength or maybe a lack of information. And complexity is really related to the different types of factors that might cause that discrepancy or maybe limit understanding of information. And I think the reason why people tend to be so uncomfortable with uncertainty is because it challenges our sense of control. And we like to be in control. We like to know all of the information. But as you said, our lives, we will never know all of the information. Uncertainty is inherent, particularly in healthcare. And that's probably a good thing, right? In 20 years, I hope the options for previvors like me is different than it is now. And that is because information is constantly changing and evolving. And so we want advancements. We want scientific advancements and medical interventions that get better and improve, side effects for patients and patients' health outcomes overall. But I think we have to be okay with uncertainty. And I think, particularly clinicians expect, well, patients too. I mean, you go to a doctor because you expect to have an answer, and physicians are there to provide an answer, right? And so oftentimes uncertainty can feel like a failure rather than what it should be, which is just the norm. It's the reality,
Right.
right? And so for clinicians, I really try to encourage them, letting go of the idea that you should have all the answers. And that means being willing to say, I don't know, or even we may never know, or we don't know yet, but I'll keep you posted, right? It means partnering with the patient to explore kind of what the best next step is based on the information that we have right now.
One thing too is thinking about, like you said, I think you use the term like probabilistic
Hmm.
in terms of certainty, like risk numbers, and I'm sure ambiguity as well also plays a role into it. But this uncertainty, ambiguity, how does that kind of impact decision making? Because like you're saying, clinicians should not be afraid of saying I don't know or this is the best that we know now, but that could change. How does somebody and you who are a patient who have also been through this, like how do you make sense of the uncertainty or making a decision on what treatment to pursue, knowing that something is not certain?
Yeah, that's a great question. And I think it's something that can be really helpful for patients to think through. The short answer is that we know from research that decisions are shaped by how we as individuals assess or appraise uncertainty. So do we see uncertainty as a danger, something that needs to be reduced at all costs? Or do we see uncertainty as an opportunity, something that spikes our curiosity? There was some researchers, Alquist and Baumeister, they published an article a couple years ago in the journal Current Directions in Psychological Science. And they talked about that there are actually positives of uncertainty. It increases your effort, it increases your emotion, it focuses your attention. And so it can actually activate learning. But I think most people, when something is uncertain, they fear it, they see it as a danger. And that's definitely something that has come up in my research with previvors. So, for example, I conducted around 50 interviews with previvors in one study, and we found that previvors who assess their uncertainty as a danger, they tended to choose risk reducing surgery, right? They wanted to reduce their uncertainty about being diagnosed with cancer in the future. And then that actually resulted in reduced distress and it improved their overall psychological well being, which is great. But then you also have previvors who are choosing surveillance, right? And so they're every 6 months going in looking for cancer. And so those previvors initially assess their uncertainty as an opportunity, and that actually reduced their distress too. But then as time went on, it required this management over time. And so they were constantly having to reassess their uncertainty as a danger. And so it created this journey of ongoing uncertainty across their lifespan. And so I think when you're as a patient, you want to think about, when I'm confronted with an uncertain situation or uncertain information, right? Do I want to reduce my uncertainty or do I want to manage it? And then what's your approach to information seeking? Because one of the main ways that we address uncertainty is to either seek or avoid information according to theory and seek social support. So those are kind of the main ways in which to manage uncertainty. And so if you're naturally a person who wants to get all the information you possibly can, right? Then that might help you kind of get a sense of what type of decision you would want to make. And sometimes there might be points where you want to actively avoid information as a way to protect yourself as well.
I'm curious to know what you think about some or what you found like that the public thinks in general of uncertainty because from our conversation it's coming to me that there's like this disconnect almost in a way. You have the public that's coming to their clinician looking for an answer, and they don't
Mhm.
necessarily feel comfortable with uncertainty. You have clinicians that are not necessarily comfortable saying, I don't know. I think in general, many physicians or providers tend to be information seeking and they like to know the information. And so there's this common kind of ground where maybe on both sides people are not comfortable with the uncertainty. What is I guess, what does the public misunderstand in terms of this uncertainty as it comes up in science or
Mhm.
medicine? That there's a difference between not knowing or being ignorant versus we cannot know.
I love this question and really appreciate your reflection there. I think there's really kind of two common misunderstandings I've seen, both from a researcher perspective, but also as a BRCA2 previvor myself. And one we've kind of talked about, number one misunderstanding is that uncertainty should be eliminated, right? That uncertainty is and number two, or connected with that, is that more information will reduce my uncertainty. It will make me feel better. It will give me back a sense of control. Well, what happens when the information you seek actually is more uncertain, or it sends you down a rabbit hole at 2 a.m. in the morning, right?
Mhm.
Or you're on TikTok or, any type of, source of information you're tapping into. So, as one simple example, I think in the genetic space, often we approach genetic testing from this perspective that information is power, which I completely agree in general. Genetic testing provides us with people like me and other previvors with information that empowers us to make informed health decisions, whether that's risk reducing surgeries or, increased surveillance, for example. But what happens, we know from research, mine and others, is that you test positive and it actually creates other types of uncertainty, which then is required. You have to manage that over time. It's this lifetime coping. So, as one example, people who with Lynn syndrome, there's a big financial component to colonoscopies and other different types of screening. And so you might decide, I want to undergo genetic testing because I want to know if I'm genetically predisposed like family members, but then you test positive and now you have to deal with the effects of that where you are, managing your uncertainty when you are trying to figure out how to pay for increased screening or, waiting for diagnostic test results or biopsy results, right? When there's something that is uncertain that's detected. So I think that's the first one. And then, I think the second common misunderstanding is that if there is uncertainty in healthcare or science or research, then it isn't trustworthy.
Hmm.
And this is again problematic because information is always evolving. And so, we again, as I mentioned earlier, we want medical advancements and we want scientific breakthroughs. And the only way to do that is to conduct more research, is to experiment, and is to wade into uncertain aspects and uncertain areas so that we can get to that point. And my mom, she's a 29-year breast cancer survivor, and she's always said to me over the years, because I've known about my inherited gene mutation for over a decade now, and my mom has always said, "You make the best decision you can with the information you have at that time." And of course, she's not an expert in uncertainty in terms of the research, but I think that so encapsulates what I hope patients, clinicians, and family members can think about when it comes to making decisions based on uncertain information.
Well, and it sounds too like that's a way to phrase it in terms of communicating that uncertainty. I didn't know if there was some
Yes.
other examples or things that you recommend in terms of like when a provider is communicating uncertainty, when they can communicate that well, what does it look like?
Yeah, that's a great question. I think number one is just to acknowledge that the uncertainty exists, right? Is to verbally call out. Like a lot of times, emotional distress is connected to uncertainty. So asking the patient questions, it sounds like you are concerned about, waiting for these diagnostic test results. Can you tell me a little bit more about that? Or not assuming that the patient is going to be most concerned about treatment. Maybe they're most concerned about actually driving to the hospital or cancer center to get the treatment or pay for the treatment, right? So, assuming that there's uncertainty there and then asking pointed questions so that the patient can share, and then providing, demonstrating empathy in these conversations, I think is really important. And then also, research says, kind of talking about what is known and what remains unknown. So a physician or healthcare provider can say, this is what we really know based on the evidence right now, but this is what we don't know. And this is what we're going to do. We're going to come up with a plan of action, whether that's seek more information or make a decision now or come back together in 2 weeks, or I want you to go home and talk to your partner about this or your family member about this, but coming up with a plan of action so the patient feels better in the moment, but also has kind of like a plan B. Does that make sense?
Yeah, yeah, and I think that helps too because again, there's an action or there's things that we're anticipating, so that does give that sense of, okay, there's some control happening here.
Exactly. Exactly. Yeah. Yeah. So it's, working together to come up with that plan of action, giving some sense of control back, but also again acknowledging and setting the norm that there are just some things that we're not going to know. And it's being okay eventually too, it's being okay knowing that the information might change in the future. I mean, you might make a decision as a patient in this moment, in this era, based on the information that is there, but you might look back in 10, 15 years and say, oh, now that we knew this, would I have made the same decision? Like, don't go down that path, right? Because you did the best that you could in that situation at that time.
Right, right, exactly. One thing that I think, is probably contributing a lot to this is, and you had mentioned the misunderstanding about like if there's uncertainty, then maybe we should be distrustful, right? Or maybe it's not true.
Hmm. Yeah.
And again, I want to make sure I'm choosing words carefully. It's sort of like there's this mix up between is something uncertain or am I confused because there's misinformation, right? And so I think that's probably factoring into people's uncertainties. They're not sure who
Hmm.
to trust for some of this information.
Yeah.
So how do patients navigate this? How do they know something is a credible resource?
That's a great question. And I really appreciate, you talking through that. Yeah. I mean, as we've discussed, one of the main ways that people, manage uncertainty is through information seeking. And, you know, online health information seeking using social media. These are all places that we as patients are going. There is the information or knowledge gap between clinicians and healthcare providers and patients has decreased, right? Because of access. But that doesn't necessarily mean that everything is trustworthy and credible, right? So I think there's a couple things that you can do as a patient or as a clinician who might be seeking health information as well. You're looking for who created this information, particularly if you're on specific websites. Is there a name? Is there the organization? Is it up to date, as another example? Is it something that has a scientific advisory board that checks in and updates information? I think you can also ask the question, does it apply to my situation? And if I don't know, then maybe interrogate that a little bit more. I think general best practices for health information seeking, particularly online and using social media, is to set up a time limit for online searching. So where you're literally on your phone, 15, 20 minutes, where you give yourself a time zone, because then you don't go down the rabbit hole of this or scrolling here, and then you start to really increase your anxiety and worry about it. And then the last thing is simply, bringing the information to your healthcare provider. And I think that this is something that we're trying to do in terms of teaching digital health literacy to patients and also clinicians, and helping them talk about information that their patients are bringing into the clinic. And I think that's so important, is to, because we have access to so much information, is it's still essential to talk to a healthcare provider who can interpret it based on your situation. And so I would encourage, clinicians and healthcare providers to be open to having those conversations and to talk about what quality information is, and tailoring that to different types of goals.
And I'm glad that you mentioned about like digital literacy, but also working on helping patients understand, but also the providers and how to respond right when that
Mhm.
comes into the clinic. What would you say gives you hope about the future of science communication, or what do you see are some areas that clinicians should be aware of in the future for like patient provider communication?
Good, great questions. I think in terms of what I hope for the future of science communication is that I think academics and researchers, especially post COVID, are really starting to see science communication as not an add on, but as an important part of the research design process that can actually directly relate to impact, right? And this is something that I emphasize when I'm conducting science communication workshops. I'm now the chair of the Society of Behavioral Medicine's Public Education Committee, which is trying to help teach academics and researchers about sharing their science, sharing their research with the general public. And so, starting at the very beginning of your research study, when you're thinking about a grant, when you're designing your experiment, who needs to get this information? And how am I going to get that information to them? And then I think, too, what I would love to see is that we're also, first and foremost, sharing our research results with the participants and the respondents who actually participated in our research. I think that's the first step, is that we have a duty to our research participants who have contributed their knowledge and expertise and lived experience
Mhm.
to us. So I think that's one thing. And then I would say, as a BRCA to Previver, I hope that more researchers directly interact with the people who they're trying to help and make a difference, right? So the specific stakeholders that they see, right? Whether that is patients or family members, caregivers, clinicians, like involving them and their lived experience, again, very early in the research design process, because I think that's going to make a difference, and it will also build trust, and demonstrate care when you are including people who live with this every day in that research design process. I think that makes a big difference.
Right, right. No, I think that community engaged, participant engaged piece is so important, and also can really help folks and researchers strengthen their study design or give them
Hmm.
other perspectives to consider. And again, ultimately, they're wanting to help these folks or these populations. So, on one hand, it seems like a no brainer, but at the same time, sometimes it's not always factored in.
Hmm. Yeah, absolutely. And there are lots of barriers, I think, to research in general, one of which is time. As academics, much like clinicians, we are, navigating time in terms of, the study design process. But ultimately, if you're really trying to make a difference with a particular group, whatever that group is, you should be involving them in the process to begin with because they have the expertise in terms of what their lived experience is like.
And I just want to take a minute to thank you for being with us today. But before we go, I do want to ask if there's a way for folks to connect with you, and we'll put some of this in the show notes as well. But you mentioned you do workshops, you teach, you research,
Yeah.
you do TEDx, you do all the things. So if somebody wants to connect with you, what's the best way to reach out?
I'm pretty active on LinkedIn. That's my main social media platform. So Marleah Dean Kruzel would love to connect with you there. I do have a YouTube channel. It's got a collection of many of the different types of talks I've given related to family communication about genetic risk information, uncertainty, and decision making. So would love for you to connect there. And then you can find some more resources or information about speaking on my website, which is www.marleahdeankruzel.com.
Like I said, we'll put all of that in the show notes as well. And Marleah, thank you so much for being with us today.
Thanks so much for the opportunity, and I wish you the best.
For more information about this episode, visit allaccessdna.podbean.com, where you can also stream all the episodes of the show. Any inquiries on the podcast can be sent to allaccessdna@gmail.com. Please rate and review the podcast on Apple, Spotify, YouTube, or wherever you listen. This helps other people like you discover the show. Note that this podcast is for entertainment and education and is not intended to be a substitute for professional medical advice. Please consult your physician with any questions you may have regarding your health. All Access DNA is an independent podcast hosted and produced by me, Kate Wilson. Designs by NKJ created the logo. Thanks for listening and join us next time.